Taenia is a genus parasitic tapeworms with about 100 species that affect dogs, cats, cattle, sheep, pigs, and other livestock. Many other wild and domestic animals as well as humans. Taenia species occur worldwide whereby abundance and incidence in different regions depends on each particular species. As a general rule, they are more common abundant in rural regions where dogs and cats easily feed on raw offal and carcasses infected with cysticercoids. Most adult Taenia worms are usually large worms that can be several meters long and up to 6 centimeters wide depending on the species.
Pathogenesis. Pets at risk for a Taenia infection are those that eat raw meat either through predation or raw feeding. Dogs infected with adult Cyclophilidian tapeworms shed egg-laden glotids in their faces. When the appropriate vertebrate intermediate host consumes the eggs, larval cysts develop. Dogs are infected when they ingest larval cysts while preying on or scavenging infected vertebrates. Clinical signs. The infection of dogs with Taenia tapeworm is mostly benign and without clinical signs. Tapeworms are rarely harmful to dogs. Most animals are asymptomatic. Heavy infections may cause non-specific abdominal symptoms such as diarrhea or constipation and abdominal pain, accompanied by ill drift and a pot-bellied appearance. Treatment is warranted.
Diagnosis of Taenia SPP. Proglottids or tapeworm segments may actively crawl in feces or around the perineal area of animals, most commonly observed by the odor. Fresh proglottids may be relaxed in water and squashed between two glass slides for morphological examination. Eggs of Taenia SPP cannot be distinguished from those of Echinococcus. Treatment of Taenia SPP. Praziquantel and epciprantal are approved for the treatment of Taenia SPP infections in dogs. Praziquantel is given orally at 5 mg or kg is drug of choice. Treatment of Taenia SPP in dogs must be combined with management changes to prevent ingestions of vertebrate prey species. In the absence of these changes, reinfection is likely to occur.
Prevention and control of Taenia SPP. Prevention of predation and scavenging activity by keeping dogs confined to a leash or in a fenced yard will limit the opportunity for dogs to acquire infection with Taenia SPP. Owners should be strongly encouraged not to feed their dogs raw offal or meat of domestic or wild intermediate hosts like livestock or rabbits. In Taenia endemic areas, dogs should be treated with praziquantel at 6-week intervals. In endemic regions, it is advisable to reduce the number of stray dogs. It may be also appreciated to reduce the number of rodents using rodenticides, since they can also act as intermediate hosts of some Taenia species.
Tapeworms in dogs are common intestinal parasites. While they're easy treatable with medication, they can lead to severe problems in young, old, or immunocompromised dogs. So, it is important to be aware of the signs. Common symptoms include decreased appetite, signs of the worm segments in feces or vomit, and failure to grow in puppies. Tapeworms do not cause significant symptoms and are largely of cosmetic concern. If you see tapeworm segments on your pets or feces, see your veterinarian for a tapeworm treatment.